men, they are usually perceived as a stronger gender because physically they are bigger and they are more muscular. But when it comes to their health, I feel it's the other way around. I feel the women are more healthier, they are more stronger than the men. Sorry to say, let me tell you why. Because my granddad from my mother's side died before my grandmom. My granddad from my father's side died before my grandmom. And if I have been looking at it, even from extended family, from my friends, I found out that the dad is always dying. The granddad is always dying first. The men are always dying first before the women. That is passing the message that the women are stronger. But that's not what I mean in this video. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference. And I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 10 health conditions that men face and also how to prevent them from happening. But before we go into details into this class, if you are new on our YouTube channel, if this is your first time on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be sharing with you 10 health conditions that the male counterpart face. If you've not watched our video on 10 health conditions that the women face and also on how to prevent it, I'm going to be leaving the link in the description box below so that you as a man can watch on behalf of your spouse, or as a woman watching this, you can also watch to get educated and prevent them so that you can have a healthy lifestyle. Because we all know that prevention is better than cure. Let me tell you something. Before I start listing the disease conditions that men face, I want you to know that the life expectancy of men is lower when compared to women. It is lower when compared to women. In America, the life expectancy of the men is 76.1 year, while that of the women is 81.1 year, with giving it a gap of 5 years. You can see from this research that we got that the 5 years difference shows that the women have a higher life expectancy when compared to the men. That is why I am here to educate the men to take care of their health and prevent what is preventable so their life expectancy can also increase. So the first one I have to share with you is heart disease. Heart disease is a leading cause of death in both the male and the female, not just the men alone, in both the male and the female. So as a man, it is important for you to take care of your heart. Yes, it is important. And the risk factor for this heart disease depends on a lot of factors. Like if you are taking a high intake, if there's a high intake of cholesterol, if you are smoking, if you are obese, these can affect your heart conditions. This can make you be at risk of heart disease. So that is the first one I have to share with you. Then the second one I have here is diabetes. Diabetes is an epidemic in some countries. Diabetes is something that we should take note of. It is something that we should educate our public about, because diabetes is eating into the society and it is taking life. Diabetes can lead to vision loss. It can cause total blindness. Diabetes can lead to stroke. Diabetes can cause a lot of things. There are different types of diabetes, but they have similar symptoms such as excessive hunger, excessive thirst, frequent urinations. When you notice this frequent urination, you are going to pee at night 4 times, 5 times at night, please and please, it is time for you to consult your doctor. Because when you notice these things on time and you begin treatment on time, it will help you to manage them effectively well and live a healthy life. So that takes me to the third disease condition or health condition that the men experience. The third one I have to share with you today is stroke. Yes, stroke is affecting a lot of men and also a lot of women today. We call it the cerebrovascular accident. In stroke, what is being affected is your brain. A part of the brain is being affected. Let me tell you what stroke, what happens when stroke occurs. Stroke, there's, for example, this is a pipe. This is a pipe. Blood is flowing through it to the brain. It's circulating. It's giving your brain enough. When there's a blockage in that pipe, that's your artery. That's the artery that's supplying blood to you. When there's a blockage, the blood will not be able to flow, and the brain will not be getting enough circulation. That is what happens in stroke. And stroke affects a lot of men and women today, and they are going down, and it's also a leading cause of death. Stroke can be as a result of blood pressure, high blood pressure. So if you are hypertensive, it is important for you to check your blood pressure and manage it adequately. It can be as a result of diabetes. Diabetes can result in stroke. You can be at risk of stroke when you smoke excessively, when you take alcohol excessively. So if you are a man, you want to live longer and you want to prevent stroke, it's advisable for you to limit smoking. It's advisable for you to limit alcohol. It's advisable for you to monitor your blood pressure if you are hypertensive. It's advisable for you to monitor and manage your sugar level if you are diabetic. With that, you'll be able to live long when compared to not managing it at all. Now, the fourth one I have to share with you today is liver disease. Yes, the liver has a lot of function in our body. The liver helps to detoxify toxic substances. The liver helps to help the body in metabolism. When it comes to metabolism, the liver also has a role to play. So if you are smoking excessively, you are taking alcohol, that can affect your liver. That can affect the function of the liver, and that can make you go down with different liver disease conditions. So please and please, if you are a man and you can, it is advisable you limit or stop smoking, and also limit or stop alcohol, because this smoking and alcohol, they affect the men a lot, and that affects the liver. The fifth one I have to share with you today as a concerned woman is cancer. Yes, a lot of men are battling with prostate cancer, colorectal cancer, and also lung cancer. So as a man, if you notice a change in the prostate, for example, you are feeling pain down there, there is bleeding during urination, there is bleeding during ejaculation, or blood, let's put it that way, there's blood coming out during the ejaculation, there's blood coming out during urination, I would advise you see your doctor, because that could be a sign of prostate cancer. There's also colorectal cancer. Please and please, when you notice any bleeding or abnormal things down there, please speak with your doctor. And there is also lung cancer. Lung cancer, smoking has been identified as a leading cause of lung cancer. You can see that smoking is not good for your body as a man. So if you can, avoid smoking totally, because smoking can cause lung cancer. Then that takes me to the sixth one. What I have to share with you is COPD, which is chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, which is your bronchitis and your emphysema. These can actually cause respiratory problem. The people battling with this find it difficult to breathe very, very well. And we all know that smoking affects the lungs. Smoking affects the respiratory system. So if you can avoid smoking, limit your alcohol, or avoid alcohol as much as you can. The seventh one I have to share with you is HIV/AIDS. HIV, which means human immunodeficiency virus, and AIDS, which means acquired immunodeficiency syndrome. This is also a leading health challenges when it comes to the male counterpart. According to the Center for Disease Control and Prevention, they said that 1 in 7 men that have HIV do not know they have HIV. So sexually transmitted infection, AIDS, is also a leading challenge. So men, is not just the women that should be taking care of their health. You as a young man, you as a man generally should take care of your health very, very well. Then the other one I have to share with you is depression. Yes, depression. The men, they usually form, they are stronger. Yes, they are. Like as the word medicine, yes, they are stronger. But they should learn to speak out. I feel the men, the way we see them, we make them to keep quiet. Like they hardly express their fears. They hardly express their feelings, because if they do, they say, are you not a man? Can't you handle it? Please, it is time for we to allow the men to speak out. So please, if you are a man and you're having a challenge, something is bothering you, please don't keep it to yourself, because depression is not good for your health. So look for help somewhere. Look for a friend that you know, okay, you can actually confide in, that you can actually communicate with. If possible, see a therapist to help you out of that depressive episode, because depression is real and depression can kill. Depression can lead to suicidal thoughts. So please and please don't take depression for granted. If you are feeling too sad for weeks, you normally say, oh, I'm just feeling sad, I'm not in the mood of talking. You can do that for a few days, like 1 or 2 days or some hours. But if it becomes weeks, if it becomes months, please and please speak with a therapist or speak with someone that you trust can help you. The ninth one I have to share with you is influenza and pneumonia. What I have here is that men are about 20 times more likely to suffer the complications of influenza and pneumococcal infection. Please and please, men, take care of your health. It is very, very important. We as ladies, we want to stay with you till death do us part. Aside that, we want to see you live till old age. We don't want you to leave us alone. So that is why I'm here to help educate you today, to take care of your health. Stop smoking as much as you can, because generally smoking is bad for you. Though this video is not to tell you about smoking, but you can see most of your health conditions I listed, they are linked to smoking and alcohol. They are linked to smoking and alcohol. So stay away from smoking gradually. I know it's going to be difficult, but I'm going to make a video on how to stay away from smoking, how to do away with smoking, how to quit smoking. I'm going to be making a video on that so it can help you out for those that are interested in quitting and those that are interested in putting their health, making their health a priority. Then the last one I have to share with you is unintentional injuries, like injuries. You know, the men, they are the one that ride power bike, they are the one that usually ride bicycles. So we have women riding bicycles and power bike, but the men, they are on the higher side, they're the one riding all those cars, they are the ones doing all the riding most times. So they are prone to unintentional injuries like traumatic brain injuries and all that. So please and please, while driving the power bike, while driving the bicycle, while driving, take precautionary measures, put on your helmet, put on your seatbelt. Just make sure you are fine for us, because we want you to be happy and we want you to be good. So these are the 10 health conditions I have to share with you today in regards to the men. And I hope this video is beneficial and educational for your own good. Please, if you got value, don't forget to share with a friend. It is very, very important. You don't just keep knowledge to yourself alone. Introduce your friends to our channel. They might find our video very, very interesting. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. I said that before. Thank you, and have a wonderful day ahead. Bye, and see you in our next video.